Ken, thanks for keeping us on top of it. A measles outbreak that started at Disneyland is now spread to 4 states. And in the last 24 hours, we have just learned a patient from Colorado was possibly exposed then to 300 people. Dr. Kristen Woodward joins us with important information to protect your family's health. Thank you for being here, Dr. Woodward.
Absolutely.
First off, what kinds of symptoms would we be looking for? Because let's face it, Colorado Springs is not that far away, and certainly someone who was exposed could travel here.
Well, measles is highly contagious, and it kind of has this classic presentation. It's sort of this two-phase illness. And what happens first is you have about 4 days of a very high fever, anywhere from 101 to 104 or 5 degrees. And at this time, you also have a cough. You'll have very red, runny eyes, a runny nose, and a sore throat. About through this 4 days, about 4 days after, you'll develop a rash, and it usually starts behind the ears, goes over the face, onto the chest, and the arms and the legs.
And that's really telltale.
Telltale, it's classic. The rash can last up to 2 weeks, and it can be itchy.
One of the confusing aspects of this whole outbreak is the vaccination and who got it and who still needs it, that kind of thing. Can you kind of explain who might want to look into their immunity?
Absolutely. So the vaccine was first presented in the United States in about 1970. Between 1970 and 1990, most people got 1 shot. Now that gives you about 95% protection from the measles virus. After 1990, we started to offer 2 shots, and it's a very effective vaccine. You get an over 99% immunity from the 2 shots. Now, if you were born between 1957, we know it was so prevalent that likely that you've been exposed. So you're probably okay if you've been born before 1957. Kind of that gray zone is 1960 to 1990. If you've gotten 1 shot, you probably are pretty well protected. After 1990, 2 shots, you're very well protected. So what we recommend is if you've had an acute exposure, we can absolutely test and make sure that you're immunized. If you're not and you're going to travel, or if you're pregnant, if you're one of these high-risk groups, you might want to talk to your doctor about it and talk about a booster or getting tested.
Well, that helps clear it up. Thank you, Dr. Woodward.
Absolutely.
We don't want to panic about this, but we want to be informed, Kirk.
We definitely want to know, those of us with kids, or we're all wondering, did we get the shot? We think time to call mom and figure out exactly what immunizations you have.